common and an important cause of diabetes and other metabolic conditions, even cardiovascular diseases. And as many of you know, obesity has become common even amongst the rural people and poorer people. So RSSDI would like to focus on prevention of obesity. It has formed the task forces. It wants to request all the RSSDI state chapters to work towards prevention of obesity. It's also important to prevent obesity in the childhood and in the young people. So we should start spreading this awareness about the ill effects of obesity in the children in the schools and the young people in the colleges, and take this forward so that we ultimately prevent some of the non-communicable diseases, especially diabetes and other cardiovascular diseases.
Hello friends, I'm Dr. Sanjay Agarwal, diabetologist from the city of Pune. I'm Secretary of the National RSSDI and Head of the Department of Medicine and Diabetes at the Ruby Hall Clinic. Today there's a growing epidemic of diabetes, and it kind of parallels with the epidemic of obesity. But here I'm not really going to talk much about diabetes. What we are really going to concentrate on is obesity, because we know that obesity is the mother of all evils and probably the root of all non-communicable diseases, be it diabetes, hypertension, heart disease, lipid abnormalities, breathing difficulties, osteoarthritis, number of things. What is important is in India, currently the prevalence of obesity ranges from almost 11% to 26%, and no age group is barred. We are also seeing an increasing prevalence of childhood obesity, and that is not very good, because we are seeing young population obese who are going to be faced with the burden of non-communicable disease at a later point of time. Women in childbearing age as well as postmenopausal all have seen an increase in the spurt of obesity. But what is unique to our population is we tend to have a lot of central obesity. That means fat around the abdomen.
Hello dear friends, I am Dr. Bansi Sabu, immediate past president of RSSDI, and currently I am president of Indian Obesity Society. On this World Obesity Day, 4th March, I just want to give message to all my colleagues that obesity awareness in our country is very poor. It is actually an underappreciated medical condition, and most of the patients and the doctor, they feel that it's like a healthy condition. But to be very frank, it is the condition which is the driver for most of the non-communicable disease. And I feel that all organizations, all physicians, all doctors of IMA should work together to increase awareness about diabetes, obesity, and other non-communicable disease which are primarily because of obesity. If we can prevent obesity, we can prevent many non-communicable disease in our country. Thank you.
Hi, I am Dr. Brij Makkar from Delhi. Obesity is a major healthcare challenge, and it is possibly mother of all important diseases of adult life. Obesity leads to an increased risk of diabetes, high blood pressure, heart disease, heart failure, many cancers, joint problems, lung problems, breathing disorders, sleep apnea, and you can go on counting. But unfortunately, people don't recognize obesity as a healthcare problem. They don't recognize obesity as a disease. In India, 1 in 5 people are either overweight or obese. But unfortunately, these obese people, when they go to a healthcare facility, they go for multiple reasons, but they don't complain obesity or overweight as a problem. And unfortunate part is, even the healthcare providers, the physicians or the primary care practitioners, don't focus on weight or obesity as a problem. And that is why obesity goes unrecognized. I think it is high time that we start recognizing obesity as a disease process. And if we recognize this in time, we can prevent many diseases that are related to obesity. Thank you.
You've all heard of yo-yo dieting. You lose weight, you gain weight, and the cycle just continues. You need to break this cycle. Why does it happen? It happens because it's far easier to lose weight than to maintain it. After you've lost weight, there are certain hormones which go in the opposite directions of what we want, and therefore you keep on gaining weight. So the best way to prevent a weight regain is to be in touch with your healthcare professional who will guide you and help you not to regain the lost weight. You need to have a good maintenance exercise regimen, a good healthy lifestyle that is followed for life, and an exercise regimen that includes muscle training. Secondly, you also need to take care of your protein intake.
In this short video today, I'll talk about the comorbidities or the complications that are associated with obesity. And if you look at the most recent clinical practice guideline published by the Canadian Obesity Network, we can remember this as 4 M's. The first M that we all know about are the metabolic problems like diabetes, hypertension, dyslipidemia, fatty liver, hyperuricemia. But there are other important M's as well. We also must remember the M for mechanical complications like osteoarthritis of the knee, the obstructive sleep apnea, the venous insufficiency, the plantar fasciitis, and the thrombosis that can be associated in people with obesity. Another important M is the mental complications, the psychological complications that is also very commonly seen, right from depression to psychosis to anxiety disorders and even eating disorders that can be associated with obesity. The last and not the least important M is also M for monetary problems. And we know that obesity can be a limiting factor for getting employment, for getting promotions, and can cause monetary problems. But not only this, but even the health expenditure associated with the disability associated with obesity can also be an important monetary problem. So the 4 M's associated with obesity include the metabolic, the mechanical, the mental, as well as the monetary problems associated with obesity. Thank you.
Hello everyone. I am Dr. Naval Vikram. I am Professor of Medicine at the All India Institute of Medical Sciences, New Delhi, and have special interest in obesity. Now I'll briefly talk about healthy obesity. The first thing one should know that obesity is never healthy. Now this term healthy obesity is given to describe the individuals who, despite having obesity, have yet not developed any metabolic problems, that is high blood sugar, blood lipids or blood pressure. Now this is a very transient stage which may last for a short while, maybe a few years, but ultimately this will progress to obesity with metabolic problems. And longitudinal studies done have shown that healthy obesity or the metabolically healthy obesity, the risks of developing future problems are there, though less than individuals who have already developed the metabolic problems. So if you have obesity but have not yet developed any other complication, don't relax. Take care of it right now so that you do not get any future problems. Thank you.